because I have 3 meetings left. So we're going to do 3 jokes per week because I can. Because what are you going to do about it, right? So we'll start out with, where did the horse go when it left the farm? This is one of my daughter's favorite, actually. To a new neighborhood. I have a video. I thought about trying to do it, but I couldn't get the sound to work right, of her telling us this joke when she was 4. We taught it to her, and she shared it. So 22. 18 years ago.
She's probably glad you couldn't get the video.
Yes. Yeah, not that daughter. The daughter that I just moved into her first apartment. So, all right. My wife always complains that I have no sense of direction. So I packed up my things and write. Stephen liked that one. I got him with that one. All right, last one. I was going to try an all almond diet, but that's just nuts. That's all groans. All groans. All right. But Stephen liked the other one.
Jeremy, take note.
You'd be happy to know I do not think jokes are on the agenda for Jeremy's presidency. So
they are definitely not.
Yeah, we'll move on to something else. So I want to introduce our guest speaker today, Sarah Gwinn, who is a senior project coordinator for the Rutherford County Opioid Board. We appreciate you being here and appreciate Stephen for getting us arranged to have you as part of our club. And as I understand, a previous member of our club, and any previous member is always a potential future member. So just keep that in mind.
Yep.
You're on the list.
All right, thank you. Clicker.
So he should have you pulled up in just a second. We'll make sure the clicker.
There I am.
There you go.
All right, cool beans. Thank you.
Yep.
So again, thank you for having me in my official capacity. As already mentioned, I'm Sarah Gwinn. Technically, it's a little confusing about who and where I fit into here in the community. I am technically an MTSU employee under the Center for Health and Human Services in their Office of Prevention, Science, and Recovery, which is a mouthful. But my role is contracted with Rutherford County Government's Rutherford Opioid Board, and I get to be part of the process of giving out money to local community partners to tackle some issues that we're going to talk about right now. So, I did not realize how poorly some of the color contrast was going to come out. Either way, who all in here, show of hands, is familiar with the term opioid epidemic? Ooh, there's some hands there. I like that. I like that. Do you know that this has actually been going on since the 1990s? Okay, good. Yeah. So in the 90s is when this brand new pain pill came out that is definitely not addictive at all whatsoever, we promise. And you guys should definitely prescribe it to everyone for their stubbed toes, for whatever it is. And so what we have has been sort of an ongoing build where we had prescribers and pharmaceutical companies really pushing this new medication that they promised was not addictive. Turns out it is addictive. Not only addictive, it is highly addictive. And the pharmaceutical companies really liked how much money they were getting from this. And so they're pushing higher and higher dosages in their per pill manufacturing. They're putting pressure on doctors to prescribe. And this leads us from the 90s, where there's this brand new pill and everyone's super excited about it, to the 2010s. And here they're starting to see some sharp increases in people dying related to these medications. In that time period, you're also getting the first hint of law enforcement saying, hey, pharmaceutical companies, something is not quite right going on here. We're going to need you guys to regulate yourselves and let us know when you are overprescribing so we can slap your hands. As one can imagine, that went over really, really well. And that has led us to where we are now, which is beginning in 2013. That's when you start seeing a lot of the criminalization of sort of the opioid world. We've got, it's really hard to now get these prescriptions. Your pharmacies are now tracking how many opioids you're getting prescribed, who's prescribing them, are you pharmacy hopping? However, the volume that we're talking about is a really overload on the system. So things are falling through the cracks. However, your prescriptions are starting to go down. Great. That's fantastic news. We've got fewer people being prescribed these medications. The flip side is now that they can't get them at the pharmacy, where are they going? Because their body has changed. The neurology in their brain has changed because that is what addiction does. It changes how your brain maps, it changes how it changes how it communicates pain. And so now we are at the point where we've got folks now turning to the street drugs to get their medications, to get their pain relief. And this is also coinciding with the change of how street drugs are being manufactured. It has now gone from the pot that our parents smoked in the 60s and 70s to highly effective, highly maximized drugs. And meth changed in 2013 with the introduction of synthetic drugs, essentially. The drug cartels are now manufacturing their drugs as opposed to just buying it or being grown. So this has been a really big change. So that's the background. What does that have to do with today? Well, now we have, there has been over the last couple of years, starting in the late 2000 teens, there were some national class action lawsuits that came through, starting in up in the North New England area, where they were starting to tease out the fact that pharmaceutical companies were complicit in this. They knew what they were doing. They knew that what they were saying, that it wasn't addictive when it was. They knew they were lying. And they also acknowledged that they were putting a lot of pressure to get more of those things happening. Now there's this spill down effect. We now have people who were addicted to prescribed medications are now addicted to street drugs. And that stuff is devastating on multiple levels. So who's going to pay for that? We are. We pay for it right now with our tax dollars going to an incarceral system, with our tax dollars helping to pay for treatment of indigent and uninsured individuals. We're already paying for that, but they're not. So we've got these class action settlements. And with that comes some money that's really big. Doop, doop. Okay, so just for context, in 2021, that is when our community saw a peak rise in overdose deaths. And local testing of substances and tracking those OD deaths, it was a combination of prescription opioids, synthetic opioids, so like street drugs that are opioid related, methamphetamine, and cocaine. So now we've got these lawsuits. They're starting to trickle in. Do y'all remember the tobacco settlement dollars? Yeah. Yes. This is essentially tobacco settlement dollars 2.0, except opioids. So we have prescribers, distributors, pharmacies, and the pharmaceutical manufacturing folks, so like Sackler family or Purdue or whatever, are now being charged and paying out millions and millions of dollars into these national lawsuit settlements. And that's wonderful. Locally, we have our Tennessee State Opioid Abatement Council, who is sort of managing it on a statewide level. We are getting billions of dollars funneled in from those lawsuit settlements because Tennessee signed on to those class action lawsuits, and Rutherford County also signed on to it on the county level basis. And what that means is that we get lots of money. I'm going to put quotation marks around lots. But so the Tennessee Opioid Abatement Council oversees all of those funds. They are statutorily, got that right, required to do 65% of that goes through their own statewide grant making process. 35% of that gets funneled to the counties. And Rutherford County gets a nice fair amount of money over the next 15-ish years. This started, a couple years ago. We're about 3 years into it. And so now we've got about 15 years more of these ongoing settlement dollars coming in. The lovely thing is that starting off, we had a couple $1 million coming into Rutherford County. That is changing, which is sort of the conversation that we're having today. So you might be wondering, what are we doing locally with these dollars? So Rutherford County government established the Rutherford County Opioid Board. It is comprised of 8 people. 3 are elected county commissioners. The remainder are staff of Rutherford County government, mostly from the judicial and carceral system. So we've got probation, the recovery courts, the workhouse, and they have contracted with MTSU, me, to help them do a data-driven and evidence-based grant administration of those funds. Because we have seen, like we saw with the tobacco, just throwing money at a problem doesn't always deliver the results that you're hoping to achieve. And so that is what we do. I am a grant administrator by trade. I've been doing grant writing, grant management, all that for the last decade. And now I get to do that work, but on a funder side instead of on a please give us money side, which has been the bulk of my experience. So with that, we have created a grant application process that is recently actually just wrapped up. We can't make any formal announcements until next week. But what happens is our community will complete an application. There are a list of allowable activities that they can use this money for. And it's probably like 14 pages of allowable activities that could be framed in almost any work that a nonprofit does. You could probably find a way to frame it as being allowable within the requirements of the grant. But there's limited money, which means we have to be a little bit more selective in how those funds are administered. So that's what I do. They created our office to do just this. So again, I'm so sorry about that. So in the last couple of years, I've got our prior year grantees listed here. We've got a variety of agencies. We've got folks who are in the prevention space. We've got Endure Athletics. We've got Interfaith Dental. We've got Prevention Coalition for Success. The Rutherford County Schools receive funding to do county-wide prevention programming in the schools. We've got some treatment providers who are doing direct addiction treatment for individuals who are uninsured, underinsured, as well as unhoused. Through Hustle Recovery and Volunteer Behavioral Health. We've been working in the recovery support sphere as well, which covers our Child Advocacy Center, working with kids whose parents have been addicted to drugs, who are now being exposed to that, and working with them to prevent escalation of foster care placement, sort of preserving families. We've got Doors of Hope. Greenhouse Ministries has been one of our grantees, Kamari House, and then probation. So we've done a lot of work in the prior year. That year we gave out $1.1 million to be spent in a 12-month period doing programming, and we made them report quarterly on how they were doing. 2025, we gave out $2 million in funding, and we increased the number of agencies that we were supporting. We were able to add Journey Home, Threshold Recovery, a couple other brand new organizations, Murfreesboro Cold Patrol. And so to date, this is our current grantee year right now. We've touched over 2,500 individuals, and that does not count the students in Rutherford County school system because they don't report until next month. But the year before, we were able to log over 7,000 people touched. And this is meaningful touches. This isn't just they saw a billboard and they moved on with their lives. These are people who came to Interfaith Dental and received an opioid risk screening because they're there because they are in pain. And dental pain is often one of the earliest introductions to an opioid medication. So like this is screening folks at risk who are already in pain and then connecting them to the resources as well as a work ready smile. So this is helping people avoid a relapse if they have a prior experience and getting them well on the recovery pathway so that they can then live a full life and then contribute back to the community. So 2025, 2026 is still wrapping up. It'll close out at the end of this month, and then it'll take me 3 months to do our year-end report because I have a lot of data to crunch. But with that comes sort of a good job, and here's your consequences. So the first few years, the State Opioid Abatement Council had a particular algorithm with how they determined who got how much money. And it was based on your opioid overdose deaths. And we have done a very good job at reducing our overdose deaths. I've got a chart later where you can see it. It is a very good job. And when I say we, I'm not talking about I'm talking about the community at large has done a very good job of reducing those deaths. But with that comes the congratulations of good job. Now you get less money because we think you don't need it anymore because you've reduced your opioid deaths. So this last year, they recalibrated their algorithm, and we are going from getting over $1.4 million in year one. Now we are getting, in this year, we're getting just around $800,000. Good job, y'all. The challenge is that all of those grantees that you saw on the previous screens, they're doing real work in our community of helping redirect kids who are at risk due to their home or their environment or their general situations, redirecting them from self-destructive behaviors to better coping skills through sports or after-school programs. We've got treatment facilities who are providing treatment at no cost to these individuals because they have no money. They cannot do it. And the only other option is to keep doing what they have been doing. What they have been doing hasn't been working. And so now we have less money. What does that mean for our community? Well, it means there's going to be greater risks. We're probably going to see some increases in our overdoses. And there's a challenge there. There's a give and pull here. We've done a great job. I'm afraid of seeing what that is going to look like in the next couple of years, but we're not as bad as it used to be. Speaking of, so back in 2021, that was our high peak of fatal overdose deaths in Rutherford County. We had 141 individuals lose their lives to this disease. In those intervening years, 2022 is when we started doing this funding program, and we're seeing incremental drops. Look at that drop between 2023 and 2024. That's pretty impressive. And I've got a caveat to talk about with that. Have any of y'all ever heard of the words naloxone?
Yeah.
Narcan? Anyone just carrying it around in your purse? No? You should.
Yeah.
I did for a while and then it expired. Thankfully, I never had to use it, but nonetheless, those deaths, that decrease can be directly related to the increased prevalence and access of naloxone in our community. What we don't see is those folks who used to die or used to go to the emergency room for an overdose reversal. They're not, because they have access at home. So what we now have is an invisible number that we can't put a finger on of who's missing here. We have the data on our overdose fatalities. We have data on our overdoses, our non-fatal overdoses, and those are also going down. But we're missing a piece here. This is not a problem solved situation. This is an ongoing challenge. But we're still working on this. So the distribution of naloxone has become a lot more prevalent. Interfaith Dental provides overdose reversal kits to a lot of their clients who come in. One of them actually resulted in an overdose prevention taking place because one of their clients took home a kit, put it up on top of the refrigerator, and her roommate OD'd. She was almost gone. She grabbed it, administered it, called 911, and we have a life saved. That's a real person in our community. That's not on there anymore. So, good job, Interfaith Dental. Y'all are doing real work. Another impact for this continuing decrease is by connecting folks to treatment and recovery services covered by this funding. Between those nonprofit organizations, I also foster collaboration so that we're able to make sure that we're providing sort of a wraparound support. So it's not just this silo for housing, this silo for your dental health, this silo for getting that therapy component. We're connecting all of our grantees together in the hopes that we aren't losing anyone in the cracks, so that they don't fall through the cracks. And the other part of that is stigma. I'm really happy to see so many people at least say that they're familiar with these words, familiar with this medication. The truth is that we probably all have someone in our lives who has been dealing with something like this. It might be a prescription misuse. It might be street stuff because they can't get it through their prescribers. Regardless, these are our loved ones. You know someone. You do. I can stand here and be like, you definitely know someone. But if you don't know it, it's because they've been doing a really great job masking it. And one day they might not be able to. And there's going to be a cry for help. And I hope that you won't look at them and view this as a moral issue. Because addiction is not a moral issue. Your brain function has changed. And it requires a medical approach. So, we're addressing stigma in the community with conversations like this. So, as I said, our work is continuing. So, a phrase that I like to borrow from one of my prevention people is that the opposite of addiction is community. This is community. Where you guys go back to your offices, that's community. Your church, that's community. Addiction thrives when a person is feeling isolated and alone. And it could be isolated and alone in a room full of people that they know and love. So I want to encourage you, pursue community. Pursue creating what that community looks like, and pursue a recovery-informed approach to community, where this is something that you are going through and we will walk this journey with you. Because without that, we're not going to be successful in continuing to drive down those last few opioid overdose deaths in our community. Because as long as they are alive, there is still the chance for recovery. That's what I've got. So if you want, I've got a QR code to my OPSR website. I'm going to be updating the website this week because application periods are closed. And you'll be able to access my year-end report for last year. I think it was something like 40-something pages last year. It was a lot of fun putting together. And then you can also, the second QR code is the Rutherford Opioid Board's website, their own website. We're walking out recovery and what this means, having this ability and resources in our community, what that means to them in terms of them thriving beyond addiction. So, questions? Yes.
Do shows like Euphoria help or do they make things worse?
Well, I haven't watched Euphoria, but anything that glamorizes in a way probably isn't going to be the best narrator of a true experience. So I'll go with that since I haven't seen it, but I know enough about it a little bit. Yes.
And those of us in the community get Narcan to keep with us.
Yes, you can. So the Rutherford County Health Department has that available. You can just go in. I think there's a small form you can fill out. You can purchase it from any pharmacy, although they might run it through your insurance and then things might get weird. Again, stigma. Insurance is going to be like, are you okay? So you can do it that way. You can pay for it out of pocket. There are a lot of nonprofits that also have it. I know Murfreesboro Coal Patrol keeps it on hand to distribute to clients in need. But oh yeah, the ropes. The Tennessee Department of Health has coordinators that go around and do opioid prevention. And if you want, you can actually invite them to come and do a presentation training at your office. And whoever attends that training will get an opioid reversal kit that you can then keep on hand, put it in your purse, put it in your, well, don't put it in your car because it needs to be in a certain temperature. But all of that is free. There is a lot more low cost, no cost access in the community for that naloxone. So
Well,
if you want some.
Follow up to that is liability.
So Tennessee has some Good Samaritan laws that do shield individuals from administering Narcan. If there is a suspected overdose, you are shielded in that administration of that medication. But there's still a lot of fear about that liability. So that's an understandable concern. But there are Good Samaritan laws to help address that. Yes.
So, how do you spot somebody experiencing an overdose, and is there a harm in administering Narcan or anything if they're not experiencing an overdose?
So the nice thing is there is no harm if you administer naloxone to someone who is not experiencing an overdose. So an overdose is going to look like they are going to be incapacitated, laying down, slumping to the side or whatever. Their breathing is going to be shallow. They're going to have a pallor to their face because what is happening is the opioid is impacting their breathing. So they're not getting the oxygen that they need. And so that affects their coloration. But they're going to look like they just passed out. Depending on how far along in their overdose, you might see foaming, you might see very concerning frothing at the mouth, a little bit of everything like that. They're not going to be responsive. You're going to do the whole rescue awake, like, hey, are you okay? They're not going to respond. That being said, if you are administering naloxone, you give it and you back away about 5 steps because they will come up swinging. Because it does not feel good. It is like an instant worst hangover of your whole life, and they are going to be uncomfortable. So that's when you go ahead and call 911 before you've done all of that, and hopefully things will be able to do a safe handover. Yes.
2 questions. You mentioned a program. Would a program like that with opioid training, would this club qualify for something like that as one of our programs?
Oh, yeah, I bet Ropes would love to come and do that.
Okay.
I can connect you with Will Taylor.
Right.
He covers this area.
The second was you showed some data about opioid deaths going up and then coming down. But how does that compare to data statewide? Do you know?
So the COVID epidemic, where everyone was at home and isolated and alone and lonely and feeling really uncertain, that peak is pretty consistent across the state and nationally. Some communities are making sort of steady downward trend headway like we are. Some are not. Different counties are administering their dollars very differently. Some of them decided to pave a parking lot. Now they have to pay that money back because that is not one of the allowed expenses. So, it depends on the local decisions in terms of how they're applying that money and is it actually delivering the results that they hoped. So Rutherford County has been told that they are considered one of the leading communities to do this in a very data-driven way, which of course makes me feel great. But we are making a faster decline on our deaths than most of our other surrounding communities. Yes.
So I think everybody is kind of familiar with the, I was injured, I had surgery, dental pain, whatever it is, and that's how it gets started. Since access legally has been restricted, what is the change in how people become addicted? So how many people are just, it's recreational right away? I would assume that's a higher percentage because if you see the deaths continuing to go up, because those restrictions started going into place before COVID.
Yeah, in the 2010s.
Yeah, but
is when you started.
But then we see the spike, which I understand why we saw the spike. But so how do people become addicted when the legal access is less restricted? So you don't start there.
Part of it comes into play of when someone is smoking that joint, they think it's just pot. It's not. It's fentanyl, laced in, and fentanyl is that highly, highly addictive. Like you do it once or twice, and you're like, I need more of that in my life. So part of it is a recreational introduction. Part of it is through like a medical introduction, and then moving on to the street level stuff. Part of it is community. A lot of times people who are wanting recovery and they can't leave where they're living because their community, that is not a bad thing to do drugs. Like that is just the norm. If they can't be removed from that, recovery is a lot harder to the point of impossible. So it's a variety of scenarios, home experience, physical experience. This thing crosses income lines in a way. Like Williamson County, the highest income county in our state, they also have a big issue with this. So this is not an income issue to get addicted. It is an income issue for treatment. So it's a multifaceted challenge.
The early legal access created this whole ecosystem of illegal access. So then when you start restricting the legal, it doesn't matter because it already started the whole.
Yeah.
And that's something I guess I'm just someone that never sought out how to obtain anything illegally. I don't know, but I'm always.
And then as prevalence of those illegal substances are infusing through our community, it's just easier to access. It's just easy to access. We're on 24. We are on a huge superhighway of sex trafficking and drug trafficking. It's not hard to go find a fix if you want to.
So Sarah, I'll go back to the data of 40. And I see that decline there from 114 to 40.
Mm-hmm.
And I think about the introduction of fentanyl and how it's become so much more prevalent.
Yeah.
Interesting to think, is that 40 number, what is that age range?
Oh, that is all deaths in the county. Primarily, if I'm remembering correctly, primarily we are seeing increases in overdose deaths in the middle age, and also 65 plus. Because unfortunately, this data does not tease out, I think, hospice opioid. Doesn't tease that out. So the data collection is flawed, but because it goes through the state, we don't get to crunch those numbers ourselves.
So real quick, so do you mean hospice abuse?
No.
Or hospice the way hospice typically goes?
Just the way hospice.
So you're saying if someone's being administered morphine as they pass away,
So
it
if
gets
they
lumped
are-
into that?
Okay, so I'll give you an example.
That's
My
confusing.
mom had breast cancer.
Right.
She was at home when she passed. She had morphine in her
Sure.
system. So that was tagged, while her dying was just the logical next step. She had it in her system at an elevated level.
So then it gets lumped into there.
That's how it was explained to me. It's not universal.
It's weird.
It does seem weird.
Okay.
I do. Yeah, no, and there's also a challenge here. So this is from 2024.
Right.
They only just released those numbers. It's 2026.
Oh, so I'm quite certain that number's probably gone up. Because as I'm sitting here and I'm thinking through that, and now I see the 2024. But I think about, that generation, or if you think about what we're doing now in our community, and we're trying, majority of most people think that the majority of most drug users are the homeless people, the people that are out in our community.
That is a common conversation. That is definitely wrong.
Yeah, and that's what I would be willing to think. So I'm asking the question of how many of these deaths did not occur out in our community? How many of them actually occurred like in the home setting or somewhere amongst friends?
So, unattended overdose deaths are tricky. Rutherford County has an overdose fatality review board where they go in and do data and interviews with family members of a loved one who has died, unattended death. And I mean, so many stories that I've heard while sitting in that room listening to these people's lives have been, well, I was just in the living room and I didn't hear anything. I just went to bed and never woke up. So these are not necessarily out on the streets. These are your neighbors who passed away in their sleep. And you know what? They're probably not going to talk about it because we have the stigma associated with an overdose or a stigma associated with addiction. So I know that's a little bit confusing. The data collection is a challenge. All of our data comes from Metro Nashville, and they're 2 years behind. And it's a little bit of a mess, but it's the best we can do with what we have. Yes.
Can you comment on the availability of drugs within the home? Because things are still being prescribed. So the use of lock boxes for family members, especially older adults, and then also comment a bit on ACEs.
Oh, adverse childhood experiences. Yes. So adverse childhood experiences are things that have happened in our life that are a challenge. So an adverse childhood experience could be that your parents were divorced when you were a kid. It could be one of them had a long-term illness. Perhaps someone was incarcerated. There's a job loss. And so there was an instance of homelessness, perhaps. There was physical, mental, sexual abuse of some sort within the home that was being perpetrated on your child. Whatever that is, there's a score. And most of us have an ACEs score between 2 and 3. The higher your ACEs score, the greater trauma you have experienced. And trauma also changes your brain structure. It remaps how you regulate your emotions. It maps how you deal with uncertainty. It contributes directly to someone's risk of developing a substance use disorder. You see folks who have had rough lives due to their childhood, who have thrived and overcome and never had to deal with a substance use disorder. That is fantastic, and I love that. You also have stories of young children who have grown up with great adversity, and because of the scenarios surrounding their lives, they were not able to necessarily overcome them. And some of them have turned to substance misuse as a way to just cope with life, because life is hard. And so by seeking to prevent adverse childhood experiences in athletics, in the school systems, by connecting parents to good parenting support, you can mitigate those to reduce the potential chance of developing those substance misuse disorders later in life. It is not a causation. ACEs do not cause substance misuse. It does not determine someone's future, but it does impact it. Now, for preventing access to medication that someone shouldn't be having in their hands, having locking boxes are vital. Disposing of your medication when you don't need it anymore, also vital. So just removing it from the home when it's no longer needed is a safe practice. There's lots of medication disposal places that you can do that. And you can also get locking medication and pill boxes as well. If it's something that you have to have as an ongoing basis, it just keeps other people's fingers out of it. Those are pretty affordable. I bet you could talk to your doctor, and if they don't have one sample to give away, they can probably tell you where to get one. But they're pretty cheap, even on Amazon. Anything else?
Yeah, we'll go back just one more, Sarah.
Okay.
So, the dollars.
Yeah.
We know there's been a reduction now.
Yeah. Because we did a good job.
A great job. Especially back 2 years ago.
You have done a great job, have less money. Yes.
And so that's what concerns me, the data from being 2 years ago,
Mhm.
but the dollars are being cut now. And so once the data does catch up
Yeah.
with where we are, and then
We're going to have to play catch up if we get more allocations. The problem is that total funding coming through these settlements are going to continue to decrease. So I think last year the state distributed like 31 million in county payments. This year is 16 million or something like that. So a significant reduction, and that's just because the settlement dollars are front-ended. So.
Thank you so much.
Yeah.
Sarah will be here for a little while with questions. So I know, I don't know if everybody in here has a personal experience, but my family has a personal connection, and it does not look the way people think it looks most of the time. So, and in the case of my family, it did not. It was more the went to sleep, didn't wake up situation. So this affects a lot of people, and I know. I had shoulder surgery several years ago, and if you've ever taken that kind of medication, even when it's prescribed appropriately, it is wild how quickly you can feel like you need to have it. So I can't imagine taking it long term and what people suffer with. So thank you for the work you're doing. All right, so hotcakes and holly. I made this presentation, sent it to Andy, and now that date is no longer tentative. I found out afterwards. So Mallory has confirmed our date with MTCS will be December 5th. 2026. So everybody put it on your calendar now, December 5th. We will have our next Hotcakes and Holly committee meeting on the 30th, which is before our induction meeting, but I want to make sure we get one done now that we have a definite date. So everyone who's interested in contributing, be there. I know I'll be there. Jeremy should be there. Andy should be there. Lee will be there. Hopefully Roy will be there. So it's time to get things kind of organized preliminarily and get things moving. So June 30th will be our next meeting. Family of Rotary, we're super excited to have Larry here. And then also on a happy Family of Rotary, I want to let you know Joseph is not here because he and his wife are celebrating their 32nd wedding anniversary. So they are off on a trip. So make sure to congratulate him next week when he gets here. And also my parents just celebrated their 56th wedding anniversary. So how about that? Any other Family of Rotary that we're missing, anyone we're forgetting about? Any exciting celebrations? My daughter bought her first couch, by the way, which is exciting.
I got a text message from Rush Coleman today, which was our friend Helen's son. His dad passed away. I don't know any, and several people from MTSU probably knew him. His name was Fred Coleman. He taught in the history department for years and years. I don't know any other information at this point. I'm trying to get in touch with Bob Jones.
Okay.
Let him know. And if I find out something, I'll let you all.
Yeah, and I'll look up his number, but if anybody here has Bob Jones' number,
Mm-hmm.
let Nancy know, phone number. If not, I'll pull it up in our previous member list. All right, also want to real quick, since you're here, Stephen, thanks Stephen for taking over our programming for at least the next year. Hopefully we'll keep going, but we appreciate you stepping into that role. Roy did a fantastic job for 3 years, I think, 3 years. So we're excited to see how our programming continues. Stephen may be reaching out to you if he feels like you can contribute to adding some speakers, that kind of thing. So make sure to answer the phone call or the email and help us get more great speakers lined up. Oh, what happened? There we go. Don't forget our Habitat panel build dedication for Pam is this Thursday at 4 p.m. So its location is 2840 Opportunity Lane. This is the house that we worked on the panel build for with the other two Rutherford County clubs. If you've not been to a home dedication, I encourage you to go. It is really cool to see the end of that journey and see the keys handed over to the homeowner. We work at a pretty early stage building the panels, but being there when it's completed and seeing that that come to fruition is pretty cool. So. Officer installation will be on June 30th. So Jeremy and our new board members will be inducted then. I will officially hand over the gavel. I scared Jeremy a little bit ago because I had that gavel in my hand and started walking over there, and he thought I was on my way out the door, I think, and just handing it to him. But we've got a couple more weeks. I'll officially hand that over in a couple weeks, and we'll get our club moving forward with the 26-27 Rotary year. Don't forget to contribute to End Polio on your table in your buckets. And let's see, I've got this up here, Regina. I've had it up every week. So let's see, we are in June, so we are still running hairspray for another, is that the 20th or 21st?
Last weekend.
Last weekend.
Margaret, they brought their fam out this past weekend too, and we had a sold out weekend. We have another sold out weekend coming up. I think we've got 25 tickets left for this weekend. We are likely adding a Thursday evening show, so just be on the lookout for that.
Get your hairspray tickets. And our next meeting, of course, will be next week on the 23rd. Lisa Nolan will have their prayer pledge and four-way test. And I feel like there was something with grants. Nope, I don't know. I felt like there was something having to do with grants, but I don't have it. Ben.
Did you mention the board meeting?
The board meeting, I did not put it on here, but board meeting is also Thursday, so you can make the dedication and you can go straight from the dedication to the board meeting at 5 o'clock. So it'll be 5 o'clock at my office, which is the Regions Bank on Memorial, not by MTCS, the other one on Memorial, which I say at least 14 times a week. So we're in front of Office Depot. Will be our final board meeting for the year. Lisa, Jeremy, and I will review the budget before that board meeting. We'll be voting to confirm the budget and kind of get the year wrapped up at our last board meeting before we move on to the next year. All right. Anything else I'm missing? Nothing? All right. Thank you so much. We'll see you all next week.
Take a look. See something like let me know. I got to be tired.